Alrighty.
Okay, we are broadcasting, and I'm going to allow a couple of minutes, not a minute, some seconds, let's say, for people to come in after the webinar has started and for Zoom to begin recording and things like that. Minu Sahi, how are you?
I'm great, Chris. How are you?
I'm great, thank you. And Dr. Scott Gledhill, how are you?
Very well this morning, thanks, Chris.
Okay, I'm going to start the presentation by sharing my screen, which let's move on to that. It's going to take a minute and everybody can get comfortable and excited. So this is a good time to talk about the fact that we're going to accept questions at the end. And let me just change my view to slideshow. Okay. So yeah, we'll accept questions at the end, and to ask a question, just press the Q&A button, which is, depending on how you're watching, it's either at the bottom of the screen or it's on your phone. You just may, I think you just have to tap your screen. In any event, welcome webinar hosts and webinar guests to treatment. What's next after an employee infection? This is one of our Safe at Work system webinars, which we hold every Tuesday in June at 12:30 p.m. And as most of you will know by now, we are doing webinars every Tuesday and Thursday at 12:30 p.m. Safe at Work is Tuesday, and wellness-focused webinars are on Thursdays. This is the third one in the series. So the first one, which previous ones you can find on youtube.com, Medcan Live Well. There was antibody screening in context. There was introduction to contact tracing. Today's is on treatment. What's next after an employee infection? And then next week's is COVID-19 and Safe at Work strategies. Our hosts today are Minu Sahi, who is a Vice President of Patient Support at Medcan. Minu Sahi is currently responsible for overseeing patient support with responsibility for product development and execution. Folks, I'll let you read on through the bio there. And then Dr. Scott Gledhill is on the Medical Advisory Services team, and he obtained his medical degree from the University of Western Ontario and family medicine residency at the Mount Sinai Hospital. And Scott, I mean, there are a lot of interesting things about your bio. I love the NHL entry draft combine, and I also love that you're on Maryland Dennis regularly, which is great, and you do a great job there. Minu, why don't I hand it off to you for the opening?
Perfect. Thank you, Chris. Great job pairing me up with a well-known celebrity here, but I'm excited to host this with Dr. Gledhill. So good afternoon, everyone, and welcome. So the discussion today is going to be what do employers need to do, or what happens after an employee contracts the infection? So at this stage of the pandemic, the Medcan's medical advisory team is recommending that the infection in our employee base is inevitable. What can we do to prepare and plan for it in advance so that we are able to contain and mitigate the risk to a bare minimum? So 3 months ago, Medcan developed a Safe at Work system focused on 4 pillars: screening, testing, tracing, and treatment for its employers. And we developed a committee at Medcan of various occupational health experts, and Dr. Scott Gledhill being one of them, who've played a pivotal role in the Safe at Work system. So Safe at Work is empowering the employers. Our medical advisory team is collaborating with the leaders in the industry of major banks, law firms, retailers, in being a directional resource, in providing guidance, different resources, and education around what do we need to do to be fully prepared. What needs to happen physically at your workspace before you bring employees back to work? How do you bring employees back to work? How do you keep them safe at work? And then again, instilling the confidence and trust in both your employees, your staff, as well as the customers of the organization, of the companies, so that they feel safe using your services. So that's what Medcan has been doing. And as a matter of fact, Medcan itself adopted the same safe at work system, so that we are having a world-class safety measures at our organization as well, to make sure that the staff is feeling safe and our customers are confident in our ability to provide them a safe environment for utilizing our services. Next slide, Chris. So going back to where we started, our focus today is what actually happens when an employee gets an infection or tests positive for COVID-19. And like I said in the beginning, that we think it's inevitable that it is going to happen. So what, as an employer, we can do to best prepare for it. What is our responsibility as an employer? What are we going to do to make sure that the infection is contained, is the impact of the infection is mitigated, and we keep it to a close group as minimal as possible? What is the checklist for us that we have to go through to ensure that we react to the situation in a timely manner, we react quickly, but the underlying sentiment, of course, is to be highly sensitive and empathetic to the situation and to the employee infected. But just to reiterate that it doesn't really remain localized to the employee who's been infected. It goes well beyond that particular employee. It goes across the organization, and it also impacts your customers, your clients, who could have potentially been in contact with the particular employee who's contracted the virus. Next slide, please. So what is our quick checklist as an employer? What is our responsibility when an employee has tested positive? So like I mentioned before, this is a very sensitive situation. So we have to be empathetic, again, not just to the situation, but to the employee who has contracted the virus and across the organization. So the first thing we have to do is partner with our HR team quickly, so that they can collaborate with the operational team to ensure that effective communication happens quickly, and again, with empathy and sensitivity. One thing, it's bullet point number 5, but it's very, very important that the privacy and confidentiality of the person who has been infected is confidential. That we cannot release the names to anybody. The only people or the teams that are allowed to know who has been infected is your HR partner and public health. So very, very important not to release the names or any particulars of the person who has been infected. And then the next step is that we have to trace. We have to figure out who the close contacts of this particular individual are, especially at the organization that it has happened, but as much as possible, encourage the individual to go beyond the work environment and trace back to their personal environment as well. Once we have the contacts traced, we need to do effective communication. Again, it's a very sensitive matter. As a matter of fact, we went through that ourselves, and everybody reacts very differently. Again, it's a pandemic. We've not experienced this ever before, first time in 100 years. So it's the newness and the unknown factor that comes into play, and every single person that you will be in touch with will react differently. So be open, be empathetic, and be very flexible when it comes to guiding them through the process. To the infected individual, of course, they need to self-quarantine, but send them with enough information and education as to what self-quarantine means, how to follow the public health guidelines, and to report to public health as well, because this needs to be reported to public health. And then communication with the rest of the organization, whether it's staff or your customers who might have come in contact with this infected individual, and recommends whatever is applicable, whether it's self-isolation and all the other education and resources that you can give them, all the while maintaining the calm to the situation. So that's a quick checklist that needs to happen when your employee has tested positive. And of course, it will be really great for the senior leadership to get involved from sensitivity and to treat the person who's been infected with utmost care so that we can resolve it and maintain calm in the organization. Again, going back to Safe at Work system at Medcan, it's a dynamic playbook, goes into details about what kind of advanced planning that we can do so that it's thorough, it's detailed, doesn't really limit to the staff screening, but it involves the physical space enhancements that you're going to do, how to follow and keep up to date with the provincial guidelines that are coming up on a weekly basis, sometimes on a daily basis. What are you going to do when the employees actually return to work? How are you going to manage the cohort of the employees who are actually working remotely? And we just covered what actually are the steps we take when the employee is positive. So with that, I'm going to pass it over to Dr. Scott Gledhill, who's going to take us through more details on Safe at Work planning. And as a member of the medical advisory team at Medcan, he's going to take us through the steps as what we need to do to ensure that we are, one, taking all the steps to prevent this from happening. And if it happens, how are we going to mitigate and minimize the impact of this as much as possible? Over to you, Scott.
Thank you, Monique. To reiterate, I just want to reiterate that we do consider this to be a relatively inevitable event, right? It is very likely that if one of your employees, it's someone you interact with or a client, will likely test positive, and you will have to deal with these situations. And so the advanced planning is going to be key to try and reduce the chances of causing an outbreak within your business or your employees. Now, this virus is spread through the air. An infected individual expels that virus into various particles in the air, either by coughing or sneezing or even just simply breathing. And that particle of virus then directly enters the respiratory system of a new individual through the mouth or nose, or the droplets fall onto objects, which are then touched and inadvertently brought to the mouth or nose by a new individual, thereby moving the transmission of the virus along. So what we want to do is develop policies and plans that are going to prevent that transmission from happening within your business and your premises. The best thing you can do is to keep employees home. The more you can separate them and keep them at home in a safe environment, the less chance of having an outbreak within your business. Next slide, please. So to do that, we want to prepare our workplace to try and reduce those transmission events from occurring. If you can monitor your entrances, have very clear signages, perhaps a separate entrance, a separate exit. If they can be monitored with someone who can perhaps employ screening at the entrance, do you have any symptoms? Have you come in contact with anyone with COVID? Perhaps encourage these individuals to use a hand sanitizer before entering the premises, whether that's employees or clients. And to ensure that proper social distancing is happening while they're lining up outside, and that only the right amount of people are let in for the amount of space you have inside to ensure they can continue to practice physical distancing once inside the premises. It's also worth looking at your communal areas, your elevators. They're going to have to be changed from perhaps a maximum occupancy of 8 down to 2, 3, or at most 4, depending on the size of the elevator, so that you have the ability to maintain 6 feet of distancing within those enclosed areas. Break rooms, as much as possible, you want to discourage that. People should bring their own lunches and fluids, their own cutlery. Coffee machines should be put away. If you have a lunch table that previously sat 8, now perhaps it sits 2. If you have benches that were designed for 3 people to sit at, you need to block off 2 of those seats so that only one person can use that bench at a time. Another strategy to employ is clustering your employees. So if you have shift workers, try to prevent them from moving from one shift to the next or exchanging shifts with a friend or partner, so that if you do have an outbreak, it's confined to that one shift. If you have a large HR department, for example, consider having only half of them come in one day and half of them come in the next day, perhaps even days and odd days throughout the month. So that again, if there is an exposure, if you do have someone test positive, you've only lost half of your workforce that is now confined to going home again and being quarantined. You also want to look at appropriate hygiene and ensure that your employees have access to hand sanitizers and where necessary masks. Now, if you're working in your own individual office, there's no need to wear a mask. If you're working in a communal space, you're dealing with employees in a communal space, sorry, clients in a communal space, ideally you should be wearing a mask, and it just shows those clients that you're taking their health seriously as well and helps to prevent the transmission of the virus. Additionally, you want to reduce the shared touch points. Any doors that can be left open should be left open. Anytime you can remove, if that's sinks that can be done through motion detectors rather than having to turn faucets. These are additional advantages and reduce extra touch points. Next slide, please. You also want to optimize your ventilation. Again, because this virus travels through the air, as much as you can clean that air out, the better. So this may mean upgrades to your ventilation system. A lot of ventilation systems, particularly in the summer and winter time when we're trying to conserve heat or cool air, will recycle the air. Ideally, you want to keep exchanging the air so that you're cycling that virus back out of your building. If you can conduct your business outside, I would encourage you to do that, particularly if you need to hold a meeting in person of 4 or 5 people within your organization. Consider trying to hold that meeting outside because this optimizes airflow and ventilation and prevents the buildup of a virus within an enclosed system. Next, you need to develop clear chain of pathway for reporting of COVID positive cases so that your employees know and is well communicated to them if they have symptoms or if in fact they test positive, they know exactly who to report that to so that that chain of command is triggered quickly and urgently so that you can move towards your next steps, terminal cleaning of the areas that employee was in, contact tracing, reducing the employees who were previously in contact with that and getting them back home or in a self-isolation so that it prevents further breakouts within your businesses, whether that's factories, employees, or even restaurants. Now, I know we spent another webinar on contact tracing, so I won't go into that, but there are some interesting cell phone apps being developed that you may wish to employ with your employees so that you can more easily navigate the issue of contact tracing should that occur. Next slide, please. Next, when can you bring these employees home? So there are a couple of official strategies that have been documented for this. The first one is a symptom approach. If the individual has symptoms and those symptoms, and they've tested positive, it must be at least 10 days since the start of the onset of those symptoms, and it must be an additional 3 days with no fever and a drastic reduction in their symptoms. And that part's a little unclear because you can have individuals who have cleared this virus but can go on to have a post-viral cough sometimes for several months. So they don't necessarily have to completely stop their cough, but they must have completed their fever for at least 3 days and be at least 10 days since the symptoms started. The test-based strategy involves actually going back and having retesting to see whether or not they are now negative. The official line is that if they test negative twice, 24 hours apart from a nasopharyngeal swab by the PCR testing, that is also an indicator that it is now safe to have them return to their work environment and interact with people. This one's also got some issues with it because unfortunately some people can continue to shed viral particles for up to a month afterwards. So simply because it continues to remain positive is not necessarily reliable. You're probably better off using the symptom-based approach. If an individual tests positive and has no symptoms and never develops symptoms despite having a clear positive test, then it's 10 days from the time of their positive test till they're considered incapable of transmitting virus and can return to work. Next.
Okay,
good. Let's do the questions portion. Sorry, Chris, I'll give it back to you.
No, that's great. Well, I think the first question, before we move on to specific questions, I just want to draw people's attention to, again, you can submit questions through the Q&A function in the Zoom webinar. The first question pertains to that last slide about when it's safe for people to return to work. There's been a lot of talk about immunity and how long immunity lasts. So having employees return to work is predicated on the fact that they're immune at that point to the virus. But how long does that immunity last is the question.
So just to clarify, Chris, having them return to work isn't predicated on them being immune to it. It's predicated on them being no longer capable of transmitting it.
Okay.
Right? So they don't necessarily have to be immune. We need to ensure that they're not capable of transmitting it to other employees, and that's why they can come out of quarantine. Because this is such a brand new virus, sadly, the truth is we don't know how long immunity lasts. There are some good studies that have come out showing clearly there is immunity for at least 2 weeks after patients who had severe enough infections that they required hospitalization. So we know for at least 2 weeks after hospitalization, there is good evidence that they are incapable of acquiring a secondary COVID-19 infection. We have many experts who postulate that that immunity probably lasts at least months, possibly as long as years, but we don't know for certain the answer to that question yet. So it's unfortunately not a guarantee that simply because you've had it, you can't get it, but it's highly probable that once you've had it, you're probably not going to be capable of acquiring it again, at least until we see immunizations roll out within the next year.
Okay. Yeah, great clarification on there too. Scott, this is again for you. Will a vaccine ever be developed? And what's the latest on the news about the vaccine?
So the news is encouraging, to be honest. There are many vaccines. There's something like 100 different vaccines currently in development. There are 5 or 6 that are front runners and that have already shown some pretty impressive results at being able to prevent the transmission in animal models. Some or 1 or 2 of those vaccines have now already moved into what we call phase 3 trials, where this is being rolled out in humans. And so we're already using these immunizations in humans. We'll then need to study them for at least a couple of months, ensure there are no major side effects, ensure that they do in fact now confer immunity as a result of these immunizations. But my guess is that even as early as late fall, late autumn, before the end of the year, we will have several approved vaccines that are ready for rollout. I know that in anticipation of this, they have already started mass producing some of these vaccines that they are optimistic will be useful. So although this is not going to be, ready for the billions of world population anytime soon, I would be optimistic that in the early new year, we will have some commercially available and be able to start rolling those out to those people who are at greatest risk. And that hopefully by this time next year, the majority of the population will have the option to use an immunization vaccine if they so desire. Which I would say.
That would be fantastic. Minu, this might be more toward you. Has there ever, in this, so this webinar is about what happens after an employee infection. What should an employer do if somebody has been infected and hasn't told the employer or hasn't notified the employer, and somehow you find out late? Well, like, what is the next step there?
That's interesting. So you hope that the employee tells you, because it's as much for their own safety as it is for the rest of the organization or the people who they might have come in contact with. And otherwise, public health actually takes it upon itself as well to inform all the close contacts of the infected individual. So one way or the other, the employer will know, but just in case it's delayed, you still follow the exact same steps. So I assume in this case, the employee is still coming to work because they haven't disclosed that they are COVID positive. So even though you are late in finding out, as soon as you find out, you go back to your checklist and inform HR and do the tracing and follow all the steps that we talked about earlier. And again, you cannot disclose who has been infected to anyone else other than HR and public health.
I'd like to comment on that too, Chris, if I may.
Yes.
I just want to say that again, the best way to prevent that situation is to ensure that it is a non-punitive reporting, right? You want to make sure your employees feel comfortable and safe reporting so that there is no incentive for them to hide that fact if they feel that it's going to take away their holiday days, or they're going to be forced to lose something financially or some other promotion by reporting it. So you need to make sure that the employees know there's absolutely no punitive consequences to reporting this so that they feel very comfortable coming forward.
Yeah.
And then that's less likely to happen.
Yeah, and going back to Safe at Work system and the playbook that we've partnered with other organizations as well as Medcan itself, there is screening at the time of booking. There is screening at the time the staff members walk into the door. So the screening actually takes care of it too. And then there's a triage mechanism where if you are answering yes to any questions, or if your vitals are not where they should be, it's like, to Scott's point, it's like a very calm environment where they are taken for the next level triage. So there is no, like no punitive measures are taken, or, it's not broadcasted that so-and-so came in and they've tested positive. And so you still have to, as an employer, maintain calm. But going back, we need to have all those things in place so that we can mitigate these situations.
Just to be clear, so if I just as a person, if I go to one of the COVID-19 assessment centers and I get a test, I get a positive test from the nasal swab PCR test, does public health inform my employer?
They are supposed to inform everybody who you've come in close contact with. They will not call the employer, but they will call all your colleagues that you might say that you've come in contact with. And public health will make the decision depending on what the role and the impact would be, whether to inform HR or not. But they usually let the person themselves make that decision and do that. Actually, I don't know, Scott could comment. He has had way more exposure. I am yet to hear any instance where a person has tested positive and not disclosed. Like I said, it's such a weird situation. It's almost surreal. First time in 100 years, a pandemic where people actually are taking the responsibility for their own safety as much as for the rest of the people they're coming in contact with.
I must admit, I have not heard of a situation where someone has sort of hidden that information either. But I will also say that, as much as that's how the system is supposed to work, as Manu described it, that public health has been at times overwhelmed, and not everyone is getting contacts traced at this point. Hopefully, as
Dave,
the pandemic reduces, we'll have the ability to do so.
Right.
David Carr, Sean, on a podcast episode, Sean Francis, the CEO of Medcan, on a podcast episode that I produced, interviewed David Carr. And David Carr, who folks is another Medcan doctor, told a story about a guy who he had tested personally, and he had said, you probably have COVID, go home. And then he got the results back, 24 hours later or something. He called the guy and said, you do in fact have COVID. And then he said, what's that noise in the background? And it was a grocery store checkout cart going. Like he was in line at the grocery store as he was getting this. So yeah, it is nice that I think in general, most Canadians have been incredibly responsible about this, and we're seeing the results of that. But you never know about the outliers.
Agreed.
Right.
Last question, Minu, maybe you take this right off the top, but so if I'm an employer and I want new, I don't feel qualified to do this. So Medcan offers these services, the medical advisory services team, in addition to the, what we used to call CMO in a box. But can you talk about the process of how one goes about activating those services?
Yes, so like I mentioned, Medcan has this team called Medcan Medical Advisory Services Team. Dr. Scott Gledhill is a member of that team. And we have this playbook now created, which has been in the market for the last 3 months, called Safe at Work. So we partner with employers because we want to make sure that all the strategies that we are providing, all the resources, the education, right from communication with their employees to signage to physical space enhancements, is unique to that particular organization or the company that we're going to work with. We're also doing this nationally, so we have to make sure that the employers are always up to date with factual data based on the provincial guidelines. So we're providing that to them so that they can be empowered to make the right decisions. We've had instances where one of the team members has actually done an audit. So once we start this process, there's a discovery process, which is in collaboration with the company. The stakeholders are present so that we can actually sit with them, see where their gaps are and what they're looking for, and customize Safe at Work for that particular organization in that given province.
Fantastic. I'm just going to talk about the next week's Safe at Work system, and then if the two of you want to say any final words, but I'm going to go back. Sorry, folks, we'll just go back to. So next week we'll be talking about transmission, and this is really a wrapping up of the previous 3 weeks of webinars. Next week, Andrew Zamakis, who's our Chief Product Officer, and then Dr. Peter Nord, our Chief Medical Officer, will chart strategies for employers seeking to thoughtfully mitigate risk of outbreaks and reassure customers and employees. So if you've missed the previous 3 webinars, this is a good one to come in and have everything kind of summed up for you in a quick, self-contained 30 minutes. There will also be opportunities for questions. In addition, we do put these webinars on our YouTube channel, which is youtube.com/MedcanLiveWell. We will send out the links by email to all the participants at some point tomorrow. Minu, Scott, any final words?
No.
Great to be here, and thank you for having us. Thanks
for letting us participate.
Correct.
That's great. Well, folks, thanks very much, and we will see you next week, hopefully. Have a great week.
Awesome.
Thanks, Chris. Bye now.
Okay, goodbye.